9 things no one tells you about C-section recovery. 1. There will be bleeding. Although you haven't had a vaginal delivery, you will still experience bleeding after birth. Many women are often surprised by this. It can be less bleeding with a planned C-section, but if you labored, and then experienced an emergency cesarean, you can bleed just as much as with a vaginal delivery. 2. You might need help feeding baby. Whether you are doing breast or bottle feeding, feeding your baby is a whole lot harder after a C-section. You will require much more support to lift your baby, and even getting up from a chair is surprisingly hard, and a little painful. Remember, the muscles that support your abdomen were separated during your C-section, so you won't have that abdominal strength to support you. Getting your partner or other family involved is going to be critical to your physical and emotional well-being. 3. Trapped gas is really common and painful. This is one side effect that isn't talked about enough, but gas pains after a C-section can be excruciating. They will pass within about a week, but it can feel like you have a huge amount of air moving around your tummy, like a big balloon while everything settles back down after the interference of surgery. 4. It's going to feel frustrating at times. After a C-section, new mothers often struggle with stress. They must deal with caring for their newborn, alongside caring for the painful incision scar, and being far less mobile than if they had a vaginal delivery. 5. You may experience numbness. Feeling of numbness is common after C-section. It's because small nerves are severed during surgery, and it takes time for them to regrow, usually within several months, but it can take longer. It's a strange feeling, but one that should pass. 6. Difficulties in coughing, sneezing, or laughing. Coughing, sneezing, or laughing is not so funny after C-section, because your abdominal muscles that have been split open and will make you feel like you are straining your incision wound. It's not a pleasant sensation, but you can help it by having a pillow or rolled up towel nearby, so if you feel like you might sneeze or cough, then hold the pillow firmly on your scar area to support it as you do so. 7. Your scar can look uneven. The scar depends on how your baby was lying and how the scar was closed at the time of surgery. In general, a C-section scar will fade and look much better within 2 weeks, but full healing can take up to 3 months. 8. There can be long-term side effects. Some women do experience symptoms related to their C-section scar long after the operation. Some women feel pain, restriction, or a pulling sensation on or around their scar months or even years after surgery. This is normally due to the buildup of scar tissue, which can stick to muscles or even organs and cause pain. 9. For more quality content, kindly subscribe to this channel. Thank you.